Hello everyone. Today the procedure that we are going to demonstrate is about crown lengthening procedure, also famously known as CLP. Now, in what all cases do you need to perform this procedure known as crown lengthening procedure? There are various instances wherein the crown structure is damaged for either single tooth or multiple teeth. Like for example, it is damaged by caries lesion, deep caries, or due to accidental or trauma injury. In such cases, the first treatment option given by restorative dentist is to do the restorations. If not, then perform the root canal treatment and then after go for post and core treatment. In spite of doing all this, if there is not enough adequate crown structure to give a crown or a bridge, then we have the option of performing crown lengthening procedure. The major indication for this or the requirement for this is that the site should have adequate amount of keratinized tissue or keratinized gingiva. Once keratinized tissue is established to be adequate using a graduated probe, then we can go ahead with performing the crown lengthening procedure. In this, the first step is to give anesthesia. Next is to establish the probing depth. Once the probing depth is marked, we can give the incision for excision of the gingiva. Once that is done, you can take a call whether to go ahead with bone reduction or simply gingivectomy. For the bone reduction, you need to raise the flap further, do the bone reduction using rotary burrs, and then after close the site or close the flap using sutures. So let's see the case wherein we have a situation of maxillary lateral incisors, both lateral incisors damaged, and it has been referred, the case is referred to us by a restorative dentist after performing root canal as well as post and core for crown lengthening procedure.